Kansas City's Children's Mercy Hospital will not be following new CDC vaccine recommendations. Yesterday's announcement includes sweeping changes to vaccine schedules.
The advisory panel dropped recommendations for protection against common illnesses, including RSV and the flu. Fox 4's Dave DeMarco live at Children's Mercy Hospital tonight with the reaction there. Dave?
Well, they're going to be going by a different set of recommendations that actually lines up with those 18 vaccines that children were supposed to get up until the announcement of the changes yesterday. They've remained busy at a Hy-Vee pharmacy in Belton.
So we're seeing a really big surge in the flu right now. We're seeing some COVID cases, but flu has really taken off.
In the midst of flu season, the CDC and Health and Human Services announced new guidelines for childhood immunization. The departments are no longer recommending protection for children against flu, rotavirus, hepatitis, COVID-19, and some forms of meningitis and RSV, except for some high-risk groups. At Children's Mercy Hospital and its pediatric clinics, they say they will continue to follow the American Academy of Pediatrics vaccine schedule that still includes all those shots.
The AAP is the governing body of pediatricians, and pediatricians' one job is to take care of kids and make sure they grow up into happy and healthy adults.
HHS said it compared the U.S. to 20 peer nations and found that the U.S. was an outlier in the number of vaccines it gives. One of the countries the U.S. will now mirror, Denmark, has universal health care.
Vaccine recommendations from the American Academy of Pediatrics are based on American children. And I think that that's really important. We want data for our children that comes from American children because we want to do what's best for our children in this country.
Schuster hopes that will still include parents deciding to get their children flu shots that should remain covered by insurance after consultation with a pediatrician, to help protect them and other vulnerable populations to which they could spread the flu.
But I do understand that if people are seeing recommendations for the younger generation, they may be hesitant, and that's where talking to either your family or the pharmacists themselves and getting our individual recommendations is a good idea.
And another important distinction, while these are the federal recommendations, states get to weigh in too, and those usually are the ones who set what exactly vaccines you need to get into school. So John, as on both sides of the state line, the legislatures head back to session, don't be surprised if these vaccine debates take center stage there again.